Hello and welcome to a special edition of No Nonsense with Pamela Wallen. As anybody will know, this week we've been discussing medical assistance in dying. There was a report of which I was a part on the whole issue of whether we are ready to offer medical assistance in dying to those who suffer from mental disorder. We wrote a minority report because we disagreed with what the larger group said, which is that we're not ready. We believe we are, and that's what we heard from witnesses. And now the government has introduced legislation that says they will delay this whole question for another 3 years. Many of us believe this is a constitutional right. We know it's a complicated issue for people, and you come to the table with your ethics and your morals and your religion and your all of your very firmly held beliefs. But we're trying to break through some of that and have a conversation. So I've invited to help me walk all of us through it, my colleague, Senator Stan Kutcher, who is also a psychiatrist and has been involved in this issue for a very long time, and Dr. Mona Gupta. She chaired the expert panel on MAiD and mental illness. She was the chair of the task group looking at protocol development, the development of model practice standards, all of the things that we were asked to look at as a committee and to find out whether we were ready. So let's just dive right in here, and I'll go to Dr. Gupta first, if I can. How are we interpreting this correctly? You amongst the people who said we are ready, 15 of 21 witnesses said the same.
Yes, I think we are ready. We are readier than we were for legislative change in June of 2016 or March of 2021. I think the work that the federal government said that it wanted to see completed before the exclusion was lifted has been completed.
And the expert, you went through this. This is the part that you led, which is here are the protocols, here are the rules you must follow. People are not going to walk in off the street and saying, I'm having a bad day, I'm depressed, I'd like access to MAiD, please. I mean, it's just not how it works.
That's right. And in fact, that doesn't work that way for any kind of MAiD request. Nobody with a self-limiting or minor condition can access MAiD. Well, it's not going to be any different for mental disorders. We're not talking about people with transient distress, but rather people with severe treatment refractory conditions who have been suffering for years, if not decades. And this was made very clear by the expert panel on MAiD and mental illness, and it was endorsed by the Canadian Psychiatric Association and the Quebec Psychiatric Association as well.
Stan, I will call you Stan because we're colleagues, or I could call you Senator Kutcher.
No, Stan and we're colleagues. In fact, our offices are just down the hall from each other.
Yes, we can practically reach out and touch. So we sat through, and we've been sitting through this testimony, and we all heard it. And it is why we offered a dissenting report that said clearly 15 of the 21 witnesses, the 15 who were actually expert, involved, were part of the process, said we're ready. The other witnesses simply had an opinion about MAiD for those with a mental condition. So what do you make of this interpretation by the government?
Well, a couple of things. If we look back at the composition of the committee, just to start, we had many people on that committee who had never been involved in any discussions about MAiD.
Correct.
And in fact, if you look at the public record, there are some members of the committee said, I don't know why I'm here because I know nothing about the topic.
Right.
So for any government to put people on such an important committee who know nothing about the topic, that's a huge problem just to start with.
Yeah.
The other thing is that when you look at the report of the committee, it starts by saying that the healthcare system in Canada is not ready. The committee did not study the healthcare system in Canada at all. We didn't go province by province, territory by territory, and yet the majority report says the healthcare system in Canada is not ready without any study of the healthcare system. To me, this is unconscionable. How could a parliamentary committee make a recommendation on something that it never studied?
This is, I think, what's confusing. I mean, we all live and breathe this and have for years in terms of our engagement on this issue. But why would they say the healthcare system, Stan, when we know that's not what it's about? It's about the preparedness of medical professionals to assess whether an individual qualifies to have medical assistance in dying.
Well, that's a really important point. There are two things that I would like to just focus on for a bit, if I could.
Yep.
One is we forget that this is an amendment to the criminal code.
Yep.
That is federal government responsibility. The federal government is not responsible for the delivery of health care. That's a provincial responsibility. The federal government has done this before in amending the criminal code. At one point in time, using contraception to prevent conception was illegal. The criminal code was amended. At one time, making love to a same-sex partner was illegal. The criminal code was amended. At one time, a woman's right to choose was illegal. The criminal code was amended. And every single time in each of those activities, there was a huge discussion, debate, and you can almost just take the word contraception out and put in the word MAiD and you get the same arguments. Yeah. So nothing of this is new. This is a Supreme Court issue. The Supreme Court clearly ruled that to deny people on the basis of the illness that they had, if they met the criteria to medical assistance in dying, was not appropriate. The Alberta Court of Appeal ruled on that. The Truchon decision in the Quebec Superior Court ruled on that. So I don't know what else we need to have to say that we need to uphold the charter rights of Canadians. And this is so important, upholding the charter rights.
You raise such an interesting point, because this is my concern. We hear from this government like a mantra every day that it's all about choice, the choice to control your own body and to have an abortion if you choose, to your choice on your gender or your pronouns. And then it comes to this profound decision about making end-of-life decisions. And all of a sudden, no choice. We can't have choice here. Did you get any sense of that, Dr. Gupta, when you were going through this process? Because you were really commissioned by the federal government to look at this issue and assess the state of preparedness. Did you get that sense then that they were trying to backtrack or walk away?
You mean the government?
Mm-hmm.
No, I wouldn't say so. I think, though, that if you even take a look at the whole premise, the idea that we have to have extensive readiness activities, that we have to have an expert panel for MAiD and people with mental disorders, that there have to be model practice standards before they're even developed, and now 3 more years to embark on readiness activities before people with mental disorders can have access compared to all other Canadians. I think it raises the question of why this group of people is being singled out in this way when nobody else had to jump through these hoops or pass these tests in order to be able to go to their physicians and make a request and be assessed, not to get MAiD, but to be assessed if they were eligible. So the whole idea that we're singling out people with mental disorders for these years and years of activities and political processes, I think raises the question about whether the government of Canada truly sees them as equal to all other Canadian citizens.
Yeah, that's a pretty fundamental question about whether they're being discriminated against as a group. But just let me stay with you for a moment, Dr. Gupta, because it's a really important point, this state of readiness. And we hear stories in the media about this as well, which is, I don't have a proper place to live, so I'm going to go and get MAiD. I'm feeling down, I'm going to go and get MAiD. This is a very complicated, elaborate assessment process of which you have been part of the development of, if I can put all my words in the right order. But just walk us through that a little bit about when we say the medical community is prepared and ready, what are they looking for when it comes to people with a mental disorder or a mental illness?
So I think that's a really good question, because the very first thing to say is that MAiD assessors and providers have been at this now since 2016. And the most experienced ones have seen many, many patients, all kinds of patients, straightforward cases that very clearly fulfill the criteria, more complicated cases, people with mental disorders in the context of other physical conditions, people with dementia. All kinds of complexity has already been addressed. The real question is, are there any special tasks? Are there any special considerations that ought to be given when the person's request is based on a mental disorder? And that's exactly what the expert panel made recommendations about, which were eventually transferred into binding regulations in the model practice standard. So these include things like being sure that practitioners go out and get the views of the treating team that's involved with the person, so that no stone is left unturned in terms of understanding what that person's treatment history has been. It has been a recommendation, a rule, in fact, in guidance, that unless the person categorically refuses, their family, their social contacts should be consulted, not to veto the decision, but to give relevant information about how that person has been doing. It was made very, very clear that in order for somebody with a mental disorder to be considered to have an incurable condition, they need to have an extensive history of all kinds of treatments, not just medications, psychotherapy. They must have had access to appropriate social interventions. And of course, the criminal code makes it very clear, and the panel simply had to reinforce this, that no one is eligible because of suffering related to not having appropriate housing or not having adequate income.
I mean, this is the thing that, I think sometimes people forget that the medical profession, because this is a matter that involves the criminal code, do not make these decisions lightly. They can't. They would lose their license. They might even end up in jail if they did this without due consideration, and all those things are there. Stan, let me come back to you, because you are a psychiatrist and you've seen this up close and personal. And somehow us saying that if you're in stage 4 cancer, that's more serious than having a bipolar condition for 25 or 30 years. How could we possibly say one is more serious than the other?
Well, that's an excellent point. You can't. And I have been very disappointed in some of my colleagues who have seen fit to take on the role of speaking for people who have a situation that they want to be assessed for MAiD for. But none of them have ever, that I know of, and I asked people who are in that situation if anybody ever come and asked them.
Yeah.
Nobody did. Nobody of any of the individuals who have been campaigning to stop MAiD for people with a mental disorder have even reached out and talked to people who are actually in this situation. No organization that is campaigning to stop MAiD for people with a mental disorder has ever reached out and spoken to these people. So we've long ago heard the phrase, nothing about us without us. And some of the witnesses that we heard at the committee have been very vocal for other groups saying nothing about us without us. But they seem to have some kind of self-prescribed right to make decisions for people without even ever talking to them. And I find that unconscionable. I think the other aspect that comes out of this is the committee itself.
Mm-hmm.
The committee was mandated to look at the readiness tasks. So the database, was it ready? Yes, it is. The model practice standard, was it ready? Yes, it is. The training program, accredited, by the way, by the Royal College of Physicians and Surgeons and the College of Family Physicians, the highest accreditation you can get. Was it ready? Yes, it is. But chose to ignore all of that completely. And in fact, they even ignored briefs that were presented or read into the committee report from 4 provinces in which the people in those provinces are running the clinical and regulatory systems wrote into the committee. So that was Alberta, Saskatchewan, Ontario, and Nova Scotia. And each one of those briefs clearly said, we are ready clinically. We are ready regulatory. We have the human resources to go and do this. The committee suppressed that information. So we have a real problem. The committee did not deal with its mandate. It suppressed information that Canadians needed to know about for decision making. And we also had members who were witnesses who didn't apply the same standard of analysis to people with a mental disorder. They didn't even reach out and speak to these people.
I think the problem is, and this always comes up in any discussion, but the reason the mandate was so limited and so clear is because we are past litigating MAiD. The courts have ruled on this. The decisions have been made about whether or not in this country we have access to medical assistance in dying. And we do, but we just, when the government reconvened this committee, of which we're a part in the fall, it was pretty clear then that they were looking for people who were going to relitigate the issue. They wanted to have all of the health ministers and premiers of provinces testify, when that, in fact, as you have outlined before, is not what we were looking at. We were not discussing whether the world is in favor of MAiD. We were discussing whether we were ready to offer it to those in need.
If I could make a comment on that point, actually, because it involves the model practice standard, which you mentioned at the beginning, and it's a great example of what you just described. In fact, for reasons that I don't understand, the committee accepted the testimony of somebody who was not in any way involved in the development or the peer review of the model practice standard, saying that it was inadequate, when in fact all of the regulators of physicians and nurses themselves participated in the development of the standard. It was revised according to their feedback, and yet the committee privileged testimony of someone who is not a regulator and was not involved in the process over the regulators themselves.
Yeah, I think, Stan, that was certainly your big issue as we sat there evening after evening, which is these people were not part of the process. They don't know how these rules were, A, formulated, and B, came to a state of readiness.
Well, you're absolutely right. We had people without that experience and without that knowledge giving their own personal idiosyncratic opinion about it. We also even had times in the witness testimony when the committee may have been misled by the witnesses. Witnesses said something, and then when people checked about whether they actually did what they said they did, couldn't find any evidence of it. So we have real concerns about the knowledge base of the witnesses. We have concerns about how the witnesses have provided the information that they were asked to provide. And we have real concern about a committee that would accept the one person's opinion over top of the entire group of regulators, or over top of the Royal College and the College of Family Physicians about the quality of the work. I mean, we don't work that way. That doesn't make any sense.
No, and I know, Dr. Gupta, you were kind of shocked about that part of it. I mean, because this is what you do for a living. And then, I mean, it would be like, me giving an opinion on brain surgery, not my thing, right? So I mean,
this is perhaps a picky little jurisdictional point, but I think it sets a worrying precedent that it's not up to a federal committee to determine the regulation of physicians and nurses. Right. That is very clearly a provincial responsibility, which it delegates to the colleges of physicians and nurses. And they had already made decisions and given feedback on the way they wanted that standard to be written. So for a federal committee now to come along and say, well, that standard is not appropriate or adequate or does not demonstrate readiness, is displacing, I think, the rightful authority of those regulatory bodies and using its own authority, which seems to be off from a jurisdictional point of view.
Dr. Gupta, what do you think the consequences of this series of decisions by the government, including the most recent one, which is to delay this until after an election so they don't need to campaign on it or worry about it, and they may or may not be in office after the fact, so it won't be their problem. But what do you think in the real world this really means?
Well, I'm glad you raised that, because I think, as Senator Kutcher just pointed out now, the most important element that we need to be concerned about are those individuals with severe treatment refractory conditions who are in a state of intolerable suffering, who have been waiting, who keep being told, just wait a little bit longer. I believe Minister Holland even said those words, a little bit longer. 6 years is not a little bit longer.
Nope.
And who are quite distressed. In addition to feeling angry and betrayed, are quite distressed by this, because I think that, as some of them have publicly stated, this limits their options to die in a dignified manner. So I'm most concerned for them. And obviously, none of us, particularly no clinicians, want to see their patients find themselves in those kinds of circumstances. I'm also really concerned about the larger social message here, which is that it seems to be the federal government is saying the rights of people with mental disorders in this country are now optional. And we can choose to respect them or not, depending on the individual opinions of people who have longstanding opposition to those rights, or on the basis of whether some doctors agree with whether those people should have rights or not.
You know, and I'm going to go to you right away on this, Stan, but my area of interest and what I've been working on, of course, is advanced requests for people who are suffering from dementia or Alzheimer's, or a disease in which they will lose capacity. And when these kinds of decisions, quote unquote, are made by government, what it leads them to do is take their lives, take their own lives, and take them earlier than at all necessary, because they feel they won't ever be given the choice. They won't be given the right to choose medical assistance in dying, or they may lose the capacity to make that decision. And so we're forcing people, with our inability to make a decision or to stand up and have the courage of our convictions, we're forcing people down a really, really difficult road. Stan, you must see this yourself.
Yes, there are two things about this that I'd like to just touch base on, and one comes from the point that Dr. Gupta raised, is that we have seen a committee of the federal government expand its jurisdictional interest into areas it has no authority in, which is the delivery of healthcare.
Yeah.
We have also seen, and horribly seen, them put their jurisdictional overview into the regulatory authorities. Houses of Parliament do not have the capacity or the competency to create medical regulations, and they shouldn't be doing that. We've learned throughout history that when governments decide that they know how to regulate medicine, bad things happen.
Yeah.
That's why we have independent regulators. This committee has actually created a really bad thing. It has set a precedent, and this government has accepted that precedent, that it's okay for a group of people who are parliamentarians, who know nothing about the delivery of healthcare, to decide that they know more than the regulators who are delivering that healthcare.
Or the nuance of dealing with somebody with a mental illness.
Absolutely. The second part of that is that this is clearly an affront to the charter rights of Canadians, of some Canadians. Now, either all Canadians have charter rights or no Canadians have charter rights. And we are seeing around the world the rise of governments which are infringing on constitutional rights of people. We have seen around the world governments who are infringing on the human rights of people. And I think our federal government must, regardless of what the political party is, must stand up to defend the charter rights of all Canadians. And I'm really, really concerned that if the government isn't standing up to defend the charter rights of those who have a mental disorder, who else will they not be standing up to defend their charter rights?
Dr.
I want to add a small factual point that's just specific to MAiD, but builds on what Senator Kutcher has just told us. During the committee and during this whole debate, we've heard a lot about what's going on in other jurisdictions. And I've just been working on an article lately, so that's why this is fresh in my mind. There are currently 9 jurisdictions in the world that allow assisted dying for people who are not at the end of life. Okay, they don't have a terminal illness requirement, which Canada is now one of them. And Canada is the only one that has a legally included exclusion clause for people with mental disorders.
Really?
Yes.
So everybody has said, if you have a right to this, whether it's a charter right, I mean, that's our language in this country. But if you have a right to that, then it doesn't matter the nature of your illness. Illness is illness.
That's right. Those other 8 jurisdictions, if you have a condition and you fulfill the criteria, then you are entitled to make a request. The law does not get into, is it this kind of condition or that kind of condition? It just says you need to fulfill the criteria. Only Canada and Quebec have clauses that say, but if you have that kind of condition, a mental illness, you can't actually make a request.
This is very troubling, and we've seen all of the changes and development on so many fronts come through the courts. Now, the government has lost 3 big court decisions lately on the imposition of the Emergencies Act, on an energy-related bill, regulatory bill, Bill 69. And this is the kind of the issue you were, and also on the plastics issue, but this is what you're getting at, I know, Stan, which is, do we have the expertise to get in the weeds? Like, this is why you have the Professional Association of Physicians, or whether you're going to the energy sector to get their expertise. If that is core here, then what are we going to do? Are we just going to have to go back to the courts to settle all of this? We're going to let governments make ill-informed decisions and then go to the court and say, clean up the mess, please.
Well, you raise a really, really important point here, and there are so many subplots.
Yeah, I know.
But I just want to make an observation, and then I want to give an example. The observation that I would make is that these discussions and these committees are highly politicized. Right. They're political discussions. Exactly. So what occurs there is that the committee doesn't either have the knowledge or the ability to cross-examine witnesses. So witnesses come and they say something that maybe politically, yay, wonderful, but factually is completely incorrect. And we've seen this over and over and over again. And yet there's no mechanism to cross-examine the witness or to ask for a fact check.
Yeah.
And so I think this is one of the reasons that these things end up in court, because the courts actually have the capacity and the processes in place to not just accept, this witness said what I wanted them to say, I'm therefore going to listen to them. That witness didn't say what I wanted to say, so I'm not going to listen to them, which is a political decision. The courts actually have the authority and the necessity to make sure that the truth comes out. And so I'm highly disappointed by the way that committees work in the Parliament of Canada, because they are more interested in dealing with political agendas than with actually finding what's best for people. As an example of this, the majority committee said that one of the reasons that they said no access to MAiD for individuals with a sole mental disorder was there was no consensus amongst physicians. So, but in all of the stuff that we do in medicine, there's hardly any consensus on anything. There was no consensus, and there still is no consensus on MAiD in general. Right. And yet nobody said we can't have MAiD because there's no consensus amongst physicians. They only did it for if you have a mental disorder. Highly discriminatory on the basis of a diagnosis. So other examples that your listeners may be more aware of, there's no consensus amongst physicians about whether women in their 40s should be receiving an annual mammogram. And yet women still can receive an annual mammogram. There's no consensus amongst physicians about the provision of safe injection sites, yet they go on. There's no consensus even amongst doctors that we should allow or give advice on contraception. For crying out loud, there was a case in Ottawa about 8 years ago where a group of physicians refused to tell patients about contraception because they didn't believe that contraception was appropriate. So we've had no consensus on any of these things. The Cleveland Clinic last year actually published guidelines for patients about what they should do if there wasn't consensus amongst their doctors about their treatment. So this happens all the time, but it's only with people with a mental disorder applying for MAiD that this government says, oh, we can't do it because there's no consensus. This is highly discriminatory.
And the one place there does seem to be consensus is on the part of the public. It's 85%, 83% of the people believe that we should have access to medical assistance in dying, and that people should have the right to make those decisions about their end of life care. So just a final word from you, Dr. Gupta, on the court situation. You are the medical professional. You've been going through the regulatory process, trying to, would a court decision help you in terms of the clarity on this one? Is this what we're going to have to do again, is always run back to the court and hope somebody has a check big enough to make sure that happens?
Well, I think it's probably going to help parliamentarians because I have to assume at a certain point you can only rehash the same issues so many times because that seems to be what's happening in all of these processes. I do think, although court clarification would certainly be helpful, I do think it's something that needs to be understood what a burden that is to place on suffering, treatment refractory, distressed individuals to say, after 3 years or 6 years, now go to court and fight for your rights.
Yeah. We have really created an awful situation. What could you say to people today in the face of this latest decision by the government to say, oh, just a little while longer, just 3 more years? What do you say to somebody who's suffering? Hang in? Like, what can we possibly say?
Yeah, I do. I think there's probably nothing great to say to people who are in severe states of suffering and who had intended to make an application. I think I myself received an email from somebody yesterday who was not somebody I know, but somebody who was able to get my email address, who was quite distressed by the whole situation. So, I mean, what I said to that person is that people are continuing to work on this issue. People are taking this very, very seriously. And, we are going to do our best to see that these issues receive the serious consideration that they deserve. As an individual, there's not much more that I can do than that. But I think it's important anyway for people to know that it is serious and that there are people who believe that these statements about readiness, about needing 3 more years, about another review to look at eligibility they may be what some people believe, but other people, I think, are working to show that this is an excessive burden that no other group of Canadians has had to face.
It's almost.
If I could just make a comment here, Senator Wong. I think it's unfair to ask people like Dr. Gupta to take that on. I think the people that need to take that on is the Minister of Health and the Minister of Justice. I would like to see them sit down with individuals who have been waiting for 3 years and tell them why they have to wait longer, and tell them why their suffering isn't important, and have the ministers tell them why they've taken away their charter rights. That is what I would like to see happen.
Agreed. And we can at least work on that as professionals in this area and see if we can keep the pressure on. Dr. Mona Gupta, Senator Stan Kutcher, thank you both very much for walking us all through this very, very complicated issue and a complicated week. Thanks so much.
Thanks so much for having me.
And thank all of you for joining us for this special edition of No Nonsense with Pamela Wallin. The battle obviously continues. We'll see you soon.